My name is Kerry Morrison. I am a nurse from Northern Ireland, but I now work in neurology. So I work very closely with the MRI machine and CT scanner, and we use lots of cool equipment in theatre like CT fluoroscopy and in theatre radiographs. When I first saw the Nano, I was like, whoa, like this is like something that I've never seen before. From working in Northern Ireland, we had wasn't very up to date with modern technology there. So when I saw the Nano and thought, oh yeah, this is going to make our life so much easier. We use a Nano almost every day. If it's not in neurology, we use it in orthopedics quite a lot. So it does get our use within the hospital on a busy day, busy week, busy month. It can be used every day. The battery power of the Nano is fantastic, and we plug it in at the end of every evening, and that normally lasts us throughout the whole day through orthopedics, neurology, sometimes soft tissue uses it as well. And as long as the plate's charged, we have an extra one on standby just in case we need to use it, so it doesn't always have to be plugged in.
My name is Maria. We are in Lumbry Park, and I am a first-year resident in diagnostic imaging. Being able to do all the X-rays in theatre, I think from the anesthetic point of view and the safety of the patient is great. So we decrease the risk of regurgitation, which is the risk of the patient waking up while we move in rooms, and we avoid giving more drugs that we need to, just because the patient is in the same anesthetic machine and in the same room. So I think from the safety point of view from the patient, I think that's been really good. We use it mostly for post-op orthopedic procedures. So after putting implants, things like that, just to check that everything is okay. And also coming back to the safety of the patient is if we use the Nano and we see there's a problem with an implant or with a spin and we need to go back to theatre, then the patient is already in the room, so we don't need to come back to theatre or do anything. So it just makes all the process smoother. I think it's very easy to move it around, it's very small, so it fits in every room, and it's very intuitive as well in terms of the things that you can do with it and movement. I think it does definitely speed up any surgical process or any X-ray, so I think it will probably allow the hospital to admit more patients in that sense, because the procedures are much quicker.
I'm Victor, one of the diagnostic imaging residents here at Lumbry Park, veterinary specialist. The Nano is not as heavy as we expected, so it looks like in terms of size it's a standard one, but in terms of mobility and how we can work with it is quite lovely because it fits in every single room. Even we had a couple of problems with the X-ray, with the fixed X-rays unit, and we were using the Nano in the X-rays room. So even for that, it's quite good. In terms of workflow, means at the end for one case, for example, including the anesthesia point of view, pre-medication, surgery, and post-op procedures, probably taking 2 hours. With the Nano, probably we decrease at 1 hour and a half. So at the end, in terms of probably 8 hours and 10 hours job, instead to do 4 surgeries, 3 surgeries, we can go for up to 4 or 5. So at the end, it's in terms of profit, obviously, is a big step as well. My previous experience was these portable units. Normally the battery dures 2 hours, 3 hours. So I think with the pack that we've got here at Lumbry, with 2 batteries plus the battery of the detector, 3 batteries in total, is quite good because the battery dures probably 1-2 days. So you don't need to be keeping an eye in those things, because at the end it's if you need the Nano for 3-4 surgeries in 1 hour, you can get a little bit of stress with the battery situation. So the thing is that the whole day we are using the Nano and we forget about the battery. So the duration itself is quite optimal.
The Nano helps business side because we're able to get more and more patients in. So during post-operatively, when we use a Nano in theatre, that means another patient can be in the X-ray room having a workup. So therefore it increases our workflow a lot, which means we can get more and more rechecks in, more new patients in, and be able to get our procedures done more efficiently. I really recommend a Nano to other vet practices, especially busier ones, especially referral centres. It really helps your day-to-day, and all the staff are able to use it. You just don't have to depend on radiographers to use it. It's so easy, and yeah, highly recommended.